Hear real stories of courage, healing, and new beginnings at Refuge for Women. This is where hope is restored and futures are reclaimed.
Hey, well, today we are going to talk about the power of a shared network model. And so, one of the things that is very unique about Refuge for Women is we have 5 locations scattered across the United States that provide services on a regular basis to women who need the residential programming portion of their healing journey. And so today I'm excited to talk a little bit about what our network model looks like and the heart behind what we do here at Refuge for Women. And I am joined with one of my favorite co-workers, Miranda Korn, who is with our Texas Gulf Coast location. So Miranda, you just want to talk a little bit about Refuge for Women as a whole and being part of one mission, one set of standards, one program model that we all try to implement and effectively distribute at our locations. And what does it mean for you in the Texas Gulf Coast location to be part of a network model at Refuge for Women?
Yeah, I think it's incredible to be a part of such a large organization, all working for the same mission. Mm-hmm. I think Texas Gulf Coast being our newest location, as we got up and running a few years ago, it was great to not have to worry about what program we were going to implement, but there was already one in place that had been tested and that had been really worked through all the kinks and those kind of things. And so it's nice to be able to have something already in place to just implement rather than recreate something new. And so having that evidence-based program model has really been helpful as we've gotten this location up and going.
Yeah. You know, one of the things that I have always enjoyed about what Refuge does is back in the day when I started my own healing journey, Celebrate Recovery was like a program in a box, right? If there was a church that wanted to have a CR at their church, then you got the program, you implemented the program, and you got to, execute the 12-step, Christ Center 12-step program. And seeing that opportunity at Refuge, I think does make it easier for sites when they are looking at starting something, whether they want to be a new location and be part of what we're doing. But then also, one of the things that I really have enjoyed about Refuge as well is that we have evolved so much over the years. I know when I first got started back in 2015, our program was only 9 months long. Mm-hmm. And we quickly realized that that was not long enough to be able to provide the level of services needed for women that were going through the program. And so over the last 10, 11 years that I've been with Refuge, our program went from being 9 months to now we're in the process of being able to provide care for up to 5 years. And so we've gone through and we've piloted and added a transitional living portion of our program, which we call our reintegration program. And so that extends a transitional portion of a program experience after they've gone through our long-term program, which we call now our restoration program, because we just saw that there was a gap there. You can't go from being in a program for 9 months and then all of a sudden back out into independent living without, it's kind of like sending your kids to college, like they need to go live in a dorm for a reason. And that is a little bit of the heart behind that. But then, over the last couple of years, we've really realized that there was a huge need of a stabilization program, a crisis stabilization. That is a gap in services across the United States, and Refuge leaned in pretty hard to be able to help figure out and offer that type of programming. And so, we've just gone from a 9-month program to now having 3 phases: stabilization for 9 months, restoration for a year, reintegration for 18 months. And then we're also in the process of piloting an opportunity of semi-independent living, of what we're going to call our empowerment program. So being part of a network model, people get to innovate and figure out, test drive, some different components that we will hopefully and continue to evaluate and bring up to speed so other locations are able to implement those things as well. So let's talk about just a little bit of the desire and the heart behind a shared service cost. And so I know from a central team perspective is basically what in maybe corporate world would call headquarters. We have a central team that oversees programming. We provide a lot of the HR services, onboarding training, legal counsel, financial literacy, or not financial literacy, but just the financial portion with CPA services and all of that. Having those services provided as a shared service model, what does that help you execute as an executive director at a location?
Yeah, I think it allows us to focus truly on residents. It allows us to focus on hiring the proper staff to be able to really carry out the mission of Refuge, and then to really be able to focus on what are the resident needs. I think not having to worry about, payroll and where who's going to be the next person hired, and those kind of things make it easier for us to be able to focus on our actual programming in our locations. I think it's incredible to look at all of the things that are provided within Refuge for Women, and how each location benefits separately and differently from each of those services that are provided.
Yeah. Talk a little bit about the peer-to-peer collaboration that can happen across sites. We have 5 different executive directors within the organization, plus a central leadership team. And we have a little bit what we call our executive leadership team, where our executive directors and our central team meet on a regular basis. What are some value adds that come out of that peer-to-peer relationship as well?
Yeah, I think you mentioned earlier the different phases of our program and the opportunities that we're beginning to offer. And I think as we look at those things, whether it's from stabilization to restoration to reintegration program, or the Empower units, all of those pieces allow us to be able to look at each resident and go, where are their specific needs? And I think as we collaborate as an organization amongst EDs, amongst program directors, it allows us to see where we can best help each resident. So as program directors are, maybe take a minute and go, wow, this resident is really struggling in this area. I haven't seen this before. How can I best help them? Having that collaboration amongst other program directors helps them be able to go, oh, I've been there, I've done that. This is how you can best walk through that. This is how you can best help them. Same for us as executive directors. It really allows us to, executive director position is kind of an overarching, kind of covering all of the things at your location. And sometimes that can be a little overwhelming. And so to be able to just have other voices that have been through the same thing, is incredible. It's nice that we have an executive leadership team that encompasses all of our executive directors as well as several central staff, and to be able to meet once a week, just make sure that we're still all on the same page, have those fresh new ideas that come out of those meetings. What are best next steps for Refuge, and to be able to make those as a team. And how we want to see Refuge for Women moving forward as a whole, but with input from every location is really empowering.
Yeah. You touched on something that I think is really valuable too, of understanding our different locations might have different strengths, whether it's a particular counseling team that they'll have in place, or some of our locations, they have opportunity for Medicaid, which provides just greater access to maybe some of the medical needs that the women that are applying to come to our program. And I know that we centralize all of our applications. And so we have an intake coordinator that sees all of our applications. And I think it was last year alone, we had over 1,000 applications across all of our program homes. And we served 124 women, 16 children from 20 different states in 2025 alone. And one of the things that I value about being able to centralize the intake process is our intake coordinator knows the strengths of the different sites that we have. And so we can really place a woman who reaches out for services in a particular location that's going to best serve her.
Yeah, and I think also on top of that, it's yeah, what is best for the resident? Where are
Right.
they going to feel most at most safe?
Correct.
Where are they going to feel like they can thrive and grow and really regain that hope and dignity for themselves? And so that is an incredible opportunity that we have to be able to look at locations all across the country to figure out what is best for each individual resident.
Right. So when you were sharing earlier about placing women where they could get the best services needed for their individual needs, one of the things that we constantly have to keep in consideration is also keeping them safe. And so if we have a lady that enters through our stabilization program in the community that she was being trafficked in, 99.9% of the time, it's not ideal for her to stay in those similar surroundings. And so another value add that I feel we have is just presenting options. And we know if they choose to go onto our restoration program within Refuge at a different location, we know that the quality of care and the consistency of standards that we have, she's going to experience that. And then we get to do these things and place these women because of an incredible partnership that we've had for many years now with Southwest Airlines. And just very grateful for what they help elevate that option for the women who come into our programs because like I said, sometimes it's just not really safe for them to stay in the same community that they were being trafficked from. And so as we process through those applications, that is part of the interview process, is seeing where they feel the most comfortable. I remember interviewing a girl one time and told her how far away we were located from a big city at one of our locations. And she told me, she's like, I can't go there. She's like, I was trafficked there. And I know if I have a hard day in the program, it'll be really easy for me to manipulate my way out. And that spoke volumes to me of her drive and desire to truly get the help that she was needing, is that she knew in that moment what would have been the best option for her. And then we were able to place her in a location that was safe for her.
Yeah, I would say even speaking to that partnership with Southwest, we had a resident not long ago that when she came and she arrived at the program, she specifically said, my mom and I were both surprised that you even were willing to cover the transportation costs for me to get here.
Yeah.
And so I think just that piece in covering from beginning to end and helping them feel safe the entire way through the process and through the programming, it really does help just as they're even entering the program to know they're taking care of everything. And so I think those partnerships with Southwest and other business partners are really, truly helpful in the beginning stages of that process and programming.
Right.
One of the things that I think is just such a strong piece of Refuge for Women as far as the collaboration between locations goes is that we have a resident that maybe is in restoration program at one location, makes it all the way through that program, then enters reintegration. We had a specific resident that entered reintegration, but just wasn't thriving in the way that we knew that she could and that she was capable of. And part of that was just she needed a little more independence. And so we were able to connect her with our Kentucky location, with those Empower units where she had her own apartment and she is beginning to be able to thrive in that location. So looking individually at each resident and what are their needs, and then be able to look at each of our locations and say, this is the specific location that would best meet the need of that particular resident. And it doesn't mean that they have to have every specific program at the same location. That's part of the great benefit of us in the shared model.
Right, for sure. And going back to the network model and piloting things, I do think in this space, we know what our next growth areas are. I know at Refuge for the foreseeable future, we're not after being bigger, better, faster, stronger, and have all these sites open, although we would be open to opening more sites. But right now, we really want to focus on continuing to go deeper where we're at. And piloting the empowerment program in Kentucky is a huge piece of that vision moving forward, because we continue to be able to evaluate our outcomes and see that there are barriers still in that transition back into independent living. Affordable housing is not easy, and if you actually find affordable housing, it's typically not in the best part of town that we would like to see transition happening into. And then also career readiness and financial literacy, and just helping our graduates find a livable wage with that they can really sustain independent living long term. And so the two key areas that we're focusing in is being our own solution to those problems that we see. And so having the empowerment program available in Kentucky, and we're seeing success of residents that are transitioning there, that is a better fit for them. But we also want to see that program portion available at our locations across all 5 the locations that we have in the future. And then also just a career readiness program. We have a survivor made program that our North Texas location has been piloting for a while now. And that is, as women work through the program, we employ them, they learn a trade, they build a resume. We do career readiness trainings, whether it's onboarding and what we typically onboard for a staff member to come work at Refuge. They have to go through the same process, because that's going to be part of independent living post program. And so going and getting a drug test and having the application process and go through the interview process to get hired on within our career readiness program. And then even after that, like, they get to learn quality control, inventory, computer skills, working with hands, marketing, communications, website design. And a lot of those components and elements are what we're building within our career readiness program at Survivor Made, in hopes that if other locations desire to have that program enhancement, that will be something else that they'll be able to add. So being able to pilot programs like that at locations where we continue to see the need and how we're going to continue to respond to that need is something that I love about our shared service model that we have. So,
yeah, and I would also just add to that, I think within Refuge for Women, I love to see that, we can see something that is that's working well at one location and be able to determine, can this work well at all locations?
Yeah.
And so being able to really not just within Refuge for Women, not just decide we've been around since 2009 and we know what we're doing and we're moving forward as is. No.
Right.
What is the next right step for the women that we're serving?
Right.
How can we make things better for them? How can we get them better prepared to be independent living? How can we get them better prepared in the career readiness way?
Yeah.
And so I think as we move forward, really looking at our reintegration program and helping them become more financially literate, helping them have more career readiness, and then moving forward into helping them find affordable housing are key components for our program.
And the thing about the semi-independent living with the individual housing and the empowerment program is in those spaces, we have opportunity to serve mothers with their children. And that in and of itself is just one of the most beautiful reunifications that we can see with our graduates as they complete our program. So to have a space for moms to be able to live and still be in a shared community with shared backgrounds and histories and shared goals and dreams to continue to move forward, and have the kids be under the same roof of as their mothers is definitely a beautiful picture of that long-term freedom and restoration that we desire.
It's no longer just restoration and freedom for them, but it's breaking those generational cycles that carry on to the next generation.
Yeah. As a network model has been built over time, and I feel that even we as an organization are continuing to learn just the value add that it has. I know from a central team's perspective, and you had mentioned about the HR onboarding, training, all the back end services that we're able to provide. Being a nonprofit world, donors are always wanting to ensure that we're stewarding their dollars wisely. And so when we are able to come together and share platforms, whether it's our donor database, our HR management tracking system, tracking our residents, information on those platforms, collaboration of ideas and fundraising, and then also just having the oversight where each location isn't having to pay for their own CPA. They're not having to pay for their own human resources department, payroll processing, all of that is a combined services. One of the things when I moved into this role that really stood out to me as I started to wrap my brain around the understanding of it is that we actually can save a location between $250,000 to $275,000 a year just by sharing those services within our network model as a whole. You had talked earlier about how because of that, you guys are able to focus more on just the program component. But something else I want to make sure that we explain here is that it is not like Central's role is not making these decisions without the location's input and value add, but that also the value that the locations have in fostering their own relationships within the community and how that continues to free up time for you guys to be able to focus on the community involvement because, it takes $7 million a year to run this entire organization, and each site has a variance of their level of fundraising that they have. And so just talk a little bit about how important community connections and relationships are as you guys of where our locations are established and just the support from the local communities that are so critical to making our mission successful.
Yeah, I think that's one of the most important pieces about Refuge for Women is that we're able to have the shared services model and be able to bring those costs down. Anti-trafficking in the world in general it's very expensive to provide the services that we provide. And so being able to bring those costs down in any kind of way helps. And it allows us to share with our donors. We're doing everything we possibly can to provide incredible care for our residents while still using the shared services model to really steward their donor dollars well.
Right.
And so I think having those community partnerships, having partnerships with physicians, with dental practices that are able to really offer services free of charge to the women that we're serving really helps us to be able to have those costs come down. And also allows our residents to see that the community cares for them.
Yeah.
It's not just, yes, it's great to be able to bring those donor dollars down, but it's also a huge commitment on the part of those businesses to be able to really show that there are people that love them, that there are people that care about them, that want the best for them. And so it's really twofold. It allows us to see the opportunity that the shared service model has in helping us really steward those donor dollars well, but it also shows our residents how much they're cared for and loved.
And that always stands out to them. Anytime they can see somebody partnering with Refuge on behalf of their healing and they don't even necessarily know them, coming out of what they've come out of, and to see the genuine care that they can receive from the community of people that they might not ever know their names, that is a key element to their experience at Refuge, is just to see the wraparound support that we get from the community there.
And I know one of the things that we've talked a lot about this year is the cost per resident that Refuge for Women has, and how that because of the shared service model, that cost per resident is actually way lower than the industry standard. And so to be able to really focus on truly bringing hope and healing and dignity to women while collaborating as a whole organization to keep those costs down is truly meaningful.
Yeah. So one of the things that we say a lot, whether it's in emails or on calls, is that we are better together. And so having the shared peer-to-peer leadership, shared services, and then just shared camaraderie across the sites is it's actually priceless. This work is costly. It's hard. It takes everything of all of our staff on a daily basis. It's very emotionally, spiritually, physically, whether you're fundraising and you're out at an evening event or speaking at a church on a Sunday, it's a calling on families to be part of what we do here. And so as we work together as a shared service model and have that peer-to-peer leadership, one of the things that I love is that we're part of something greater than any one of us could not only do on our own, but any location could actually do on their own. So as we just wrap up sharing of the heart of our Refuge for Women model and what we offer here, what would you like just to share in closing with everybody?
Yeah, I do think exactly what you said. We're better together. And also I think it's not just a job, it's a calling. And to be in camaraderie with other people that feel that same calling and a passion for the mission of truly giving hope and dignity to women again is something that as we come together and we laugh together or we cry together or we share just the hardships that we're going through.
Yeah.
There's nothing better than hearing somebody on the other end of that phone call or the hug that you can get. There's nothing better than knowing that person has been there. They've walked in those same shoes and they have the same passion and the love for the women that you're serving together.
Yeah, it is. And so thank you guys so much for just listening to the heart behind how Refuge for Women is set up and just our mission and our vision to continue to provide hope, dignity, and healing through faith-based residential programming for women who've come out of being trafficked or exploited. We certainly couldn't do this without each other, and we couldn't do what we do without each of you that are taking the time just to learn more about who we are and the services that we provide. And as always, just welcome anybody to reach out anytime that you have a need or you have more questions about Refuge for Women as a whole. We definitely love to be available to answer any questions around awareness, partnership, or if there's opportunity for us to come share about our organization and your spheres of influence, we would absolutely love the opportunity to do so.